What do patients typically experience, Dr. Koehne?
Well, usually very mild symptoms in general, I would need to say. There is not an acute event that would lead the patient to go to the doctor. It's more like being fatigued all the time,
right,
or having night sweats all of a sudden, or having infections recurrently that were not explainable otherwise, or bleeding.
Right.
So that may be one source that gets the patient to an emergency room or to the general practitioner. And from there, it leads to the diagnosis.
Right. I want to bring up that graphic again because I feel like these are so common. Also, do you experience more than one of these symptoms when you may have one of these hematologic malignancies?
It may be possible that you have 2 or 3 in combination.
Right.
But and then again, the diagnosis will be established. But also, just for the sake of everybody watching the show, not everybody who is constantly fatigued or has on and often a fever or a joint pain
right.
has to be concerned this must be hematologic malignancy.
Right. How do patients usually get diagnosed? If some of these symptoms are vague and it could be many different causes, so how would a patient know?
Well, usually with these symptoms, they go to see a doctor.
Right.
And then some blood work will be done, first step. Or if there is a lymph node swollen, then that will induce some imaging studies. But usually the first step is blood work, and that will give it away in most cases. So, for example, if you have a very high white cell count, very high, that may induce the idea of that's not normal, that may be leukemia.
Right.
If you have a low white cell count, can also be multiple myeloma or a leukemia, because the bone marrow is not functioning to produce enough anymore. So
right.
blood work first, and then based on that, either next step bone marrow study or a scan, imaging studies, a PET scan or a CAT scan. If there are multiple lymph nodes that are increased, then most likely one of them will be biopsied, and based on those results, we have a better idea of how to proceed from there.